Okay, this is my go-to neck warm-up. I have 2 lacrosse balls inside of an eyeglasses container. You can do 2 tennis balls taped together. It's called a peanut mobility tool. And we'll put that down and then lay right into the bumpy part of my back, right at the top. I want that to be just about 1 finger width above this. So I put this right below that bump. And then I tuck my chin. And if your neck is already sore, you can just hold your head as you come down, and then you tuck your chin and come onto it. Then from here, I'm just gonna keep my chin down. I'm gonna rotate my head right and left 3 times. Then I'm gonna take one arm and keep my elbow turned in. So I'm not gonna whip my elbow out and do it. Elbow turned in, almost like I'm trying to touch my elbows together. One arm comes up, and then the other one. I'll do that 3 times. You can do it up to 10 times if you really want to move. And now I'll do both arms. And again, I'm moving my elbows toward each other as I come up, tucking the chin. It can be pretty tender. Good. Then I will just tuck my chin and do 3 little lifts, almost like I'm trying to seesaw or pivot right off of that part. Then I will lift up, and I can either move this down a little bit, or if you're on the floor, you can just roll the other way. So now I'll tuck my chin, roll again, and it's just on the next segment down. And then I'll go through that same thing, tucking the chin, turning right and left, and then arms. Breathing into my belly. After 3 of those, and then I'll go both arms 3 times. I'm trying to relax into it, other than keeping my chin tucked, and I can even take this down a little lower. Good. And then I'll pivot, so I can either hold my head to support it or arms crossed. Either way, I'm tucking my chin. It's like I'm doing a crunch, but it's only to the point where the ball is. And I'm going straight toward the sky, and as I go down, I tuck my chin and push into the ball. And then I can roll another inch. Tuck down, rotate. This can go lower. And then arms. Breathing into the ball, breathing into my belly. And then both arms will go. I just do this as low as I want. I can go to every segment in my spine from that big bulging bump at the base of my neck. Or I can even go up into my neck if I want. You're just not going to get as much from it. Go 3 to 5, maybe 10 times if you have the time or if you really need some support. Good, I'll do one more. Roll it down a little further. I can go in between my thoracic spine. Tucking my chin. Sometimes you'll feel pops or clicks as you do this, and that's all good. Tucking the chin. Sometimes I like to support my chin tuck and head rotation when I'm this far down my thoracic spine. I'm just kind of brushing my hair forward, my luscious locks, keeping the chin tucked. If this is too much, you can also put like a pillow or a towel or something to support you, but the further you can go back toward the table, the more extension you're getting from every segment, and the more potential benefit you have. It's another piece you can add as you inhale up. Exhale at the top. That just contracts your diaphragm, forces you into a little more extension as well with core stability, so it's not just rib cage mobility. Again, inhale up, exhale down. Keeping the chin tucked. Good. And then you can also roll off to the side if it's really tender. So that is for the mobility piece. The next piece I would do is tucking the chin, breathing from the belly, so space between the ribs and the hips. You can do measuring sticks here. As you inhale that distance really wide, and then exhale, but keep that distance. Then the side bodies get long as you inhale. Hold that distance. Keeping the chin tucked. Hold that space. One more time. Then trace the arms so the thumbs will go up the side bodies. Elbows are really high. Exhale with the belly. 3 times here. Then reach the hands up overhead. You can have that sphere of tension. Reaching your fingertips as far away from you as possible, but you can still see your hands in your peripheral vision. So from the side, it's kind of a... Good, then shake it out a little bit. Now we want to do spinal hygiene. So I'm going to be thinking about the left side of my neck lengthening as I tilt to the right. So I'm not just dropping my chin or my ear to my shoulder. I'm actually breathing from my belly up my spine on the left side until it lengthens and I feel it stretch in my neck. So once I feel that stretch, I exhale and hold it. Back to neutral. 3 times. And the exhale comes from the belly. So belly, chest, neck breath. Exhale with the belly. Then we're going to do the opposite side. Belly, chest, neck. Exhale with the belly. Feeling that stretch here. Ear going toward the sky. You also think about your jaw kind of going in a circular motion as it lengthens. Good. Just a natural stretch. You don't want to over-force anything or make it burning or uncomfortable. You might not have very much range if you're already in pain. I'm doing this today just to prevent it. I'm about to go play basketball later, so this is my warm-up for my neck, because when you're playing basketball, you're looking out for rebounds and your head's tilting up all the time. It can get sore. Next is rotation, and I'm going to use my hand to help my rotation. So you have, 7 cervical vertebrae. Most of the rotation comes from the top one. So I'm going to use my finger. I'll show you a little closer. On my neck, I'm just going to drag the skin toward, from the back where that bump is, across to the side and rotate. I'll just do that 3 times. So I'm kind of like grabbing the skin, helping the skin rotate. Good. Now I'm going to take the skin from the side toward the back and rotate. And this is more of like a release. Just letting my finger drag over it. Then I'll go, if I had 5 fingers here, that was where my first finger is. Now I'm going to go to where that second finger is. So I'll just go here, and I'll grab that where that bump is, pull it around, do that 3 times. And you're just gently going, and then I'm going to pull it from the side to the back, and then do it. And it's just like a little release. The first one actually facilitates that motion. So from here, pull, just to the natural end point, and then pull the opposite way and release. You're releasing the skin from the neck, like the structures underneath the neck. It's almost like I'm pulling the sleeve. If I want to rotate my arm, I can hold the sleeve in place and rotate it. The skin also will get kind of sticky on the structures underneath, and it can limit rotation, especially if there's inflammation. I'll go 1 more time from the bottom. I'll pull it around to the left. And then I'll release by pulling back and turning left. Then I'll go the opposite side. From the top, I'll facilitate, so I'll pull from the back toward the front. Turning left or right now, just 3 times. Then I'll go from the front to the back and turn to the right, just to get that release. Then I'll turn from the second spot, rotate, and then release. I'm using my middle finger. Third spot, facilitate, 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 and then release. And then fourth spot, turn left, pressure and pull, follow that rotation to the right. And then I'll turn left, pressure from the front to the back, and then I'll turn and release the skin and subcutaneous tissue from the fascia and the muscles. Good. Then you do flexion extension. So I can tuck my chin first, breathe into my side bodies, lengthening my chest really high. I'll actually show you from the side because you can really see what's really most important here is that as I'm inhaling, belly, chest, neck, my collarbones are gonna lift to the height of my shoulder blade here. So I don't want my collarbones forward and my shoulder blades high because that's almost like a table tilting forward, and then my head would be like a ball rolling off of the front. So I want belly, chest, till I'm neutral here. Then I can continue that breath and lengthen my neck up in the front and then extend, and I'll feel that extension in the front. So, and then exhale, but from the belly, so I'm not dropping my chest. One more. Just feeling the stretch in the front. I don't want a pinch in the back. The goal would be to get the face parallel with the floor, so. And then I'll go into flexion. The difference here is I don't want to be flexing my whole spine. I just want cervical mobility. So I'll go belly, chest, neck like I did. Then I have that length, and now I'm going to keep my chest high, tuck my chin first, almost like my head's going back, and then I'll flex forward. So exhale, but don't drop the chest. I'm really trying to get the stretch to come up into my skull. One more time. And most of us don't have too much of a trouble with that unless we have tight muscles, which need to be careful flexing forward if it's a disc issue. You can reach out if you have questions about that. But that is my neck mobilization. I feel really good now. I feel like I could go move, I could ride a bike, I could play basketball and be able to look up at the sky, whatever's going on, have kids jump on my head. But if you have questions about this, feel free to reach out. This could be done in 5 minutes or so because I was talking about it. It took almost 15. But you can quicken it once you're more comfortable, or you can just do little spot shots or do what you need in the moment. If you did this every day, you'd hardly ever have neck pain. So have a wonderful day. Peace.